Okay, thank you everyone. Hi, my name is Tiara Brooks. And here at School-Based Health Alliance, we would like to thank everyone for joining us on today's webinar titled Motivational Interviewing, the Brief Intervention of SBIRT. During today's presentation, we will review the four-step model of SBIRT, screening, brief, intervention, and referral to treatment, and identify the benefits of using brief negotiated interview tool and motivational interviewing. First, please help us with our attendance count. For those only viewing as a group, please go to the chat window in the question box and type in the name of the person registered and the total number of additional people in the room with you. For example, Tammy Jones +3. This will help us with our final attendance count. Also, all attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during the webinar, please use the question box located in your GoToWebinar control window. We will address questions following the presentation. At the end of this webinar, attendees will be asked to complete evaluation poll questions. Please let us know how we are doing. Your feedback is vital in helping us craft presentations that meet your needs. This webinar is being recorded and will be archived on our website in 3 to 5 business days. Please also visit School-Based Health Alliance for additional archive webinars for topics such as the ones you are viewing on your screen. Now, I would like to introduce our presenter today, Dr. Kate Speck. Dr. Speck has over 36 years experience as an educator, trainer in the behavioral health field. She has a strong background in addictions, co-occurring disorders, prevention intervention, suicide prevention, adolescents, pregnant and parenting women, and in training and education. She is currently with the University of Nebraska Public Policy Center as a senior research manager. As a member of the International Motivational Interviewing Network of Trainers, she has provided training, technical assistance locally and nationally in the use of motivational interviewing since 1997. I would now like to turn it over to our presenter, Dr. Speck.
Hello, everyone, and thank you so much for joining us today. I want to thank Tiara for being the manager extraordinaire and getting everything set up and helping me get things together. So hopefully now you'll be able to see my slides, and I'm actually going to move this section over here. I think I'll just leave it there. And so I really appreciate people's interest in the topic of motivational interviewing, and also in the combination with the work that has been done by the National SBIRT Addiction Technology Transfer Center. So you'll see that one of the things that we're going to do today actually is talk over some of the things that Tiara showed us, that we're going to look at the benefits of using a brief negotiated intervention. And that is to, of course, screen for drug and alcohol disorders. Going to look at a four-step model of screening, brief intervention, and referral to treatment so that you can kind of take a look at that for yourself and see how that might work in your arena. And this is appropriate for schools as well, even though originally it was developed for other venues. And then we'll do a little bit of outlining the basic elements of motivational interviewing. Again, this won't be something that you'll necessarily be able to utilize in terms of the whole model, but hopefully today you'll have some takeaways from this. So hopefully that will be helpful to you. So to just start out to talk with you about the SBIRT model, there was a systems change initiative that started because we really needed to have some way of using a very effective or evidence-based brief intervention with people who are in healthcare facilities. So that's kind of where it started out. We looked at this whole idea of reconceptualizing the understanding of substance use and redefining and then redesigning how we treat substance use problems from the past. And one of the things that we come up with is that a very effective way of looking at how do we treat substance use or how do we address it in our communities is that we have to look at it as a public health problem, because the approach is so much simpler than we had been using in the past. Now, we wanted to learn definitely from the public health system. So basically what they do is they routinely screen for different kinds of things, all kinds of matters of say, for instance, diabetes or other disorders that may be there. So there's always a screen, and there's specific questions that they ask regarding that. And what they're really looking for is potential problems. So this whole idea of it being preventative to some sense, because if you don't have these symptoms, you don't really need to screen any farther, because if those symptoms aren't there, nothing needs to be done. So basically what we'd want to try to do is get rid of over-screening or over-treating people or over-testing people, because it's not effective, number one, and number two, it's kind of costly. So historically, what we've done with substance use services, we talk about them in two areas. We've talked about prevention, which I have a great background in, and I've done a lot of work in prevention. And then we talk also about treatment, about by the time somebody is in big trouble, they end up treatment in terms of some kind of an acute illness or needing to be hospitalized. So this is a little way of thinking about that, is that typically you look at the person in the green at the bottom, there's no problem, it's primary prevention. So we're people who are using responsibly, drinking responsibly, etc. And then of course, then you see the big red ball there, and that is the traditional treatment in terms of abstinence. If you want to take a look at the way the current model, or that current model at the time had been purported, that was this whole idea of looking at the abstinence piece, and then all the people who are having responsible use, and then those individuals who are having addiction. So we've looked at just this segment of people as not needing any assistance in any way, shape, or form. However, when you get to the point of addiction, all of a sudden we have this very significant and maybe going on. So why brief intervention was put together was that the goal is to educate people and increase their motivation to reduce some of those risky behaviors. And basically what we're looking at that for is individuals who score into what we call the risky or harmful use categories. And as you can see from the previous slide, that really wasn't a part of the process. So this new look at it from the public health perspective really helped us to think about what we're doing with that. So basically, our goal is not to identify those who have a substance use disorder and need further assessment, but the goal is to identify those individuals who are at what we call moderate or high risk for any kind of problems, any kind of difficulties or barriers that may put them in that high risk category related to their substance use. Now, we have also followed what we call the definitions. So the National Institute on Alcoholism and Alcohol Addiction have classified these things for adults. Now we're going to talk a little bit about adolescents in a little bit here, but typically what we look at for the definitions of what is low-risk drinking, healthy people under age 65, if they 4 or less drinks per day and not more than 14 drinks per week. And that's, again, spread out during the day, which is, we call this a low-risk drinking. Why is that? Well, because you tend to not have as many health problems if you keep it under those limits. Healthy women and men that are over 65, we talk about them having less than 3 drinks per day, and that's simply because aging does not allow our bodies to process alcohol in the same way. So not more than 7 drinks per week is what the guidelines are saying. Now, this leaves out who? It leaves out women, and it leaves out adolescents. Let me just say that the healthy women under age 65, we're probably going to take a look at them to be the same, again, as those individuals that are over 65, because women's bodies are different, and I'll leave it at that. So we look at the hazardous area. Any pattern that increases this risk for adverse consequences and harmful is negative consequences have already occurred. And these are the guidelines that we've used for a number of years. So the SBIRT concept, again, uses that public health approach and has universal screening. Everybody that comes in gets screened. It's not anything special. It's just, let's take a look and see what we've got here. And basically what we do with that particular protocol is that we rule out people who are non-problem drinkers, that we look at the levels of risk that may be going on for folks, looking at what would the person benefit from any kind of intervention, and here we call it brief advice, and identify those individuals who may need further assessment because that's what your screening would show, and then take a look at the progressive levels of any kind of intervention based on what we call the need and motivation for change. So there's a few moving parts that I want to talk with you about SBIRT. Again, this whole idea of pre-screening, full screening again for those with positive identification. That would be if you have a screen and somebody scores positive on that, now we want to move further. It's the same thing as in a doctor's office. If they take off your shoes and look at your feet and your toe doesn't look like it's getting enough circulation, they're going to test you for diabetes. Very similar to that. So then the brief intervention is basically going over for those people who are going over the cutoff point. We may use an extended brief intervention or brief treatment for those individuals who have some ongoing problems. And then for those individuals who have a high level, high score, we're looking at, especially if they're willing to engage, going into some kind of a higher level of care in terms of treatment. So at this time, I'm going to ask Tiara to ask our first poll question, and have you take over from there, Tiara.
Sure, yes, everyone. The poll question is, the goal of the SBIRT brief intervention is to, you can please select the ones that apply. Thank you. We'll give everyone just a few seconds. Okay, a couple more seconds. Okay, I'm going to go ahead and share the results with everyone. We have 30% make sure the patient is engaged in changing, 16% help the patient to see that the problem needs changing, 32% motivate the client to make positive change, and 89% educate and increase their motivation to reduce risky behavior.
All right, thank you very much. And guess what? The correct answer is those of you who were answering D, educate and increase motivation to reduce risky behavior. That's basically what the SBIRT intervention is all about. I'll talk a little bit more about that before we get into our motivational interviewing information. So you saw this piece before. And looking at this, we have the no problem people. We talk about primary prevention for those individuals. We talk about screening and feedback and having them continue to drink or use responsibly. And then you have the big ball there with substance use disorder with, again, traditional treatment or abstinence. Well, what SBIRT has allowed us to do, which has been very wonderful, that is to add a category. And that category helps us to take a look at those individuals who have excessive or harmful or some kind of use that might be problematic. And there we go in with our brief intervention or brief treatment as appropriate. So now we're looking at a whole different model here or scale here. We've added some things to that, and it really has provided an opportunity for all of us to say it's not that you don't have to develop a problem first before we do something to assist with that. And so we have the additional piece here. Now we have the abstinence and social use as well as experimental use. And of course we have the substance use disorder, but now we have a new area to explore, and that is those individuals who have abuse or binge use type of behaviors using alcohol. And again, now I'm only subject to this on alcohol because there are other elements in here in terms of drug use, but you can look at this you can look at this the same way. So taking a look at this now, we look at this model here that we have those individuals who are low risk or absence, and I think perhaps in 2014 we had like 89% of individuals who were not people who drank on a regular basis. That's the data that comes from the National Household Survey on Drug Use and Health. So typically The larger number of individuals, really there's no need to have an intervention. A smaller number of those individuals, say about 20%, however, are going to be having some difficulty. They may be having some involvement with the law. They may be having some days off work because they're hungover. There may be some situations in which they have had an altercation with someone. So there's a few, again, hazardous and harmful and symptomatic kinds of things are happening with these individuals. And there is where they're going to screen positive, and that is perfect for what the brief intervention or the brief treatment is going to be applied. So then, of course, you have on the top end of this triangle, you have substance use disorder. And this is where, again, brief intervention and referral for additional services, that's really appropriate at that point in time. So what SBIRT has really done is they've given us a really nice model to look at for doing that intervention where it's necessary and before a person steps into the next level. Now, here I'm going to talk to you a little bit about this overview of the process. There's a few screens that are used in SBIRT that are appropriate. So typically an annual screen is done, and there are several screening tools that are used. The audit, which is the Alcohol Use Disorders Identification Test, and that's been revised a few times. The DAST is the Drug Abuse this is similar to the audit, but it's for drug abuse. And the PHQ-2 is a patient health questionnaire, just looking at mental health symptoms. So there's an annual screen. If the patients answer yes to any of these initial screening questions, then we want to do an additional screen, so a more appropriate screen for those individuals. So now we have a full screen, and there are 3 areas that we can look at. There are other documents as well, or other instruments as well, but these are ones that are very quick and easy to use and easy to train up on, so we like this. Now the PHQ-9 you'll see here instead of the PHQ-2 is because there are 9 questions versus the 2 questions. The annual screen is 3 questions on the audit, and the full screen would be the whole audit that is applied for that. So the next thing then, of course, is that if they respond and in any way that indicates that there is a risky or harmful use, this is where we bring in brief intervention. So remember that little box at the top. Brief intervention is for those individuals in the high-risk category. We want to make sure that we're applying an intervention appropriately. If you apply intervention too early, people are looking at you like, you know, they're looking at you cross-eyed saying, you know, what's going on here? I don't meet the criteria for that in their own head. And they may even say that when they do meet the criteria. So that's why we're going to get into talking about motivational interviewing in a little bit later. So again, this whole thing happens is that this brief intervention piece expands for us and is helpful for us. So if the patient response indicates dependence, that's when we refer to treatment. So this gives us an overview of the SBIRT process itself and how it's been used in the public health model that has been very helpful in the field. So that's where referral to treatment then is appropriate. Now, I've given you a couple of things in terms of the audit, the DAST, or the PHQ, which are used typically with adults, but with adolescents we use a different screen. And if you've ever heard of this the terminology of CRAFT. And so basically this is the adolescent screen of CRAFT. And it's a very easy, it's again 6 questions. And what we're looking at here is asking them, you know, would it be okay with you if we talked a little bit about some of the behaviors that might be going on in your life. And we also, there are some mood disorder kinds of things we can look at too. But definitely we want to make sure that we're talking to the adolescent and letting them know that the information from this screen is going to remain confidential. So we're typically looking at in the last 12 months. Why do we do that? Because we're looking over a period of time where an individual might be involved. And again, there may be some incidences, but if we're having a 12-month look at the situation so that we can get a bigger overview of what's happening. So drinking any alcohol, smoking any marijuana or hashish, or using anything else to get high. So this is looking at the whole spectrum of any kind of drugs. Of course, it could be opiates, farming parties, and all those kinds of things that are going on with adolescents. And if they say yes to any of those questions, so if you answered no to all 3 questions, then you answer number 1 below. And that is, again, riding in a car with someone including yourself who was high or had been using. Ever use alcohol or drugs to relax or feel better about yourself or to fit in? Using it alone? To forget? Did you forget things while you were using? Did your family and friends have a concern? Have you ever gotten in trouble? So if you answered no to those first three, then you're still going to have those screening questions. And then if you answered yes to those, you're going to answer to questions 1 through 6 as well. So we go through the whole piece. Now, the next slide here tells us a little bit how do we interpret the craft for substance use. So each yes response on questions 1 through 6 receives a point. So the more points you get, if you get 6 points, that tells us that we've got something more that we need to do and more screening is necessary or more full assessment. So you can see, look here, is that what's the recommended action? When we have someone in the low risk category, we want to give them positive reinforcement and let them know that the behavior, those are behaviors that we are anchoring down. If you have someone who is, again, the yes to the car question, discussing a plan to avoid driving or after using alcohol or not riding in a car with someone. And then, of course, if you have the moderate risk, you have either brief advice and or brief intervention, and then of course our high risk is consider referral for further assessment. So that's how you score the craft itself. There's not a lot of training that you need with this, and you can download this. It's on the National Registry or SAMHSA. You can find this on SAMHSA, and you can just put even craft into your browser, and that will be something that's fine. Now, interestingly enough, people say, how many drinks did you have? We talk about how much. I think this chart is a really nice chart because it helps us to kind of understand a little bit about the level or amounts of alcohol that someone might ingest. You want to be careful, however, not to be too concerned about the how much because every one of us may have different tolerances or different body types or different genetic predispositions. So some people can drink a little. I mean, some families have traits where you drink a little and they get sick right away, or some people can have born into families where there's a lot of tolerance. So what we want to do here is that this is a nice way for us to think about what's a standard drink? How much is really going down somebody using? So I just think this is a helpful way of thinking about this. Now I'm going to take you into next the brief negotiated intervention. And I guess I'll go back to this slide really quickly. Is that you know, it's kind of prior to asking questions, the screening questions. Again, you're kind of trying to help them decide what is the drink, because you're going to ask them those questions during your assessment. So the brief negotiated interview, which is a 4-step model of using SBIRT, is number 1, we raise the subject. Something by saying like, would it be okay with you if we talked a little bit more about the screen that you just participated in? Because that screen shows us a few things, and I'd like to see if you talked with me about that a little bit more. We might even say things like, I want to understand things through your eyes, and so I'd like to have you talk a little bit about, from your perspective, about the answers that you gave on the screening piece. And then we can summarize, you know, what the person is saying, like in a reflection, and then we can move on. Now the next piece of the brief intervention is all 3 of these are going to come up at the same time. Now we want to provide a little bit of feedback. What does it say in terms of that individual's behavior, and how do they fit in the realm of other people their age, or in terms of just the general population? Sometimes, again, if you have someone who's meeting the criteria for a problem, they may not see themselves in that way, and so providing feedback is really essential in the SBIRT model to just let them know, here's where you fall in that category. Now the next thing that we do is talk about enhancing motivation. One of the things we do about enhancing motivation is, again, we're going to talk a little bit more about motivational interviewing in a bit here, but some of the things we do is try to find out if the person has a readiness to make a change, or they are thinking about change in any way, shape, or form. So there's a couple of ways that we do that, which I will get into a little bit later. And then if a person is saying, yeah, I made a boneheaded decision, things aren't really a good way to go, and I'm ready to do something about that, that's when we start talking with them about negotiating a plan. We don't want to do this too quickly, because if we do it too quickly and the person's not ready, we're kind of stepping into an area that might get us some pushback from the client. So just briefly to review this, what is a brief intervention, a brief negotiated intervention? It's really a very time-limited individual session. We can call it counseling or consultation, whatever you would like to call it, that helps us to get the information out. It has us raise the subject, provide feedback, help them look at the motivation and find out where they're at. Are they ready to make a change or not? And then if they are, we're moving ahead to helping with the plan. So again, the goals are to educate on safe levels of substance use, increase awareness of the consequences, motivate toward changing the behavior, assist them in making choices that reduce their risk. And we want to try to understand that the goals here are somewhat flexible, and there's a lot of there's a lot of different factors in which can play a part in this. So how high did they score? How high or low did they score? What is the individual's readiness to make that change? Maybe they're ready and maybe they're not. And maybe there are some specific needs that that particular person may have at this time or another. And when I think of working with this kind of thing in schools, again, working with adolescents, I really admire people who do that, because I've done that a lot in my life, and I know it can be somewhat difficult to have them kind of get on board with you. But once you get their trust, that's a beautiful thing, because then they're a lot more willing to visit with you about these kinds of things. So you want to be open to their individual characteristics. Now, when we think about what your role is in working with adolescents, again, providing feedback, offering information on what we call low-risk substance use. You know, with adolescents, it's really hard because, again, they're underage, and low-risk substance use or giving advice on that is kind of a bit of an ethical quandary. But we can always say offering information is a good thing. So offering information, or getting the adolescent on websites that they can look at the information for themselves, offering them a pamphlet. That way, we're not saying you should not use, because if a child is already involved in substance use, again, there may be very little that we can do unless we keep ourselves open enough to listen to them. The other thing is that we want to have you do is understand their viewpoint regarding substance use. Why is it that they're using? What is it doing for them? How is it helping them? And again, you may be the person who's looking at how is it hurting them, and be able to give them a clear viewpoint on that. However, we want to find out that from the client. We explore, and motivational interviewing is a great way for us to explore a menu of options for change. We try to assist them in making new decisions about their use, support them in, again, making any changes about how can we continue to be supportive, and if necessary, give advice. And giving advice, we do that very, very carefully in motivational interviewing. We only do that when it's appropriate and when we've asked permission first. So I really like this little family circle piece. You got to ask yourself who has the best idea in the room. And typically what we want to do is client-centered care, patient-centered care, person-centered care, whatever we call that. We want to do that in the idea that who is the one who's being assessed. So I love this little joke, and it kind of ends up with, where are you going with that spoon? We're going to stir up Fred. He looks bored. Stirring him up is not a good idea, Michael. Just watch him, okay? The kid says, he likes to swim around in his bowl looking for food, enjoying the view. I know. I just want him to do it faster. And a lot of times that's what happens to us, is we kind of feel pushed that we have to do something right away. And I'm going to encourage you to just slow down, take your time, let them come up with the ideas about change at first, because again, it's their life or their world. Nobody likes being told what to do, of course, and when they come up with their own answers to things, they're much more likely to be receptive to change. All right, we're going to move into the next poll question here. So I have another poll question, and Tiara, go ahead with that.
Yes, we would like to ask everyone, which of the following would you do first in the process of engaging patients in change? If you can just please take a few moments to answer the question. Okay, in a couple more seconds. Okay, we have 73% enhanced motivation by eliciting the patient's concerns and 27% raise the subject of a target behavior.
Okay, and those of you who answered C, raise the subject of the target behavior, that is the first step. This is what we want to do to engage them is, again, raise the subject and asking them. Okay, let's move on. Thank you, Tiara.
You're welcome.
All right, so now we're going to talk a little bit about motivational interviewing. And we have a whole, again, great information out there on MI and its practices. And at the very end of our work today, I'll tell you about 3 resources that we found, some books that might be helpful for you in working with schools, parents, teachers, and students. So we have a lot of advanced practice kinds of things that have gone on with MI in many disciplines. So if you can see here, so many disciplines have had success and evidence that shows that the motivational interviewing works with these interventions in these disciplines. So it's fairly safe to say that as we move ahead in the years, after 30 years of looking at the research in motivational interviewing, we have a lot of evidence that shows us, what it's doing to help us. And so here are what I want to call the basics. Now, I won't get to go over all of this kind of stuff, and we definitely aren't going to practice it today. However, we want to focus on a specific behavior change. We call that the target behavior. We also think about this motivational interviewing style, or what is called often SBIRT, which I'm going to talk a bit more about. Then asking open questions, affirming the strengths and change efforts that the person has already engaged in, if any, making reflective statements, fostering this collaborative atmosphere. We call this autonomy and personal choice, and again, allowing this freedom piece. And then, of course, a lot of practice. And I've been doing this since for about 16 years now, and I still feel like I have an awful lot to learn when it comes to looking at my skills based on motivational interviewing. So what we're looking at here is that how does it really help us? When we're doing it well, it helps us to identify what we call is a major barrier to change, and that is a person who's ambivalent. I don't know if I should change or not. And you'll hear that a lot in terms of conversations that go on with individuals who are facing a dilemma. I don't know what to do, they'll say. We try to understand how the person feels about change, and so we do a little readiness assessment. How, where are you at on the scale of readiness? And so that's very helpful to find out, where the individual's motivations lie, and where often that happens. We have some skills we talk about and how to use that, which I'll share with you a bit later. We develop rapport, and of course that's that trust I was talking about earlier, and how important that is that the adolescent sees that they can trust us. Establish this partner relationship, and then evoke, and once those things are done, then we can move ahead and evoke and reinforce what we call change talk, which is a very important concept in motivational interviewing, about really looking at it and looking for it, finding it, and actually chasing down change talk. And there's certain ways that we do that. Now, the spirit of motivational interviewing contains these elements, and we often talk about just the overview of those. The evoke is a big part of what we do. We're trying to get ideas from the person, so that's why we raise the subject and provide feedback in the SBIRT model. It's collaborative. In other words, we stay away from the expert role. We let the fish swim around in the fishbowl doing his fishy thing versus stirring him up with a spoon. Autonomy, again, respecting their right to change or not. And then compassion, and that's that whole idea of when they kind of have what's best in mind, we want to be open to just try to understand it from their perspective, and that's what compassion is. Now, all of this adds up to the idea, excuse me, of partnership. And we're partnering with the individual to explore a situation, explore maybe some solutions to the situation. And so we talk about the basics here of motivational interviewing is really the spirit that we really want to have this partnership that envelops or encompasses all of these areas. Now, we often talked about the MI shift, or the way of thinking is a different way of thinking, because especially when we're working with adolescents, of course, they're minors, and so oftentimes we get activated more around that because we're worried more about them, and they're making some decisions that we might classify as being boneheaded. But the MI shift is that we stop feeling responsible about changing that individual's behavior and into a different element, and that is to support them to think about and talk about their own reasons or means that they have for behavior change. So we're not making this happen, we are partnering with them and supporting them in looking at it. And it may not seem like we're doing enough at that point in time, but believe me, with that kind of attitude and that kind of change, a lot of people actually feel a lot more freedom to be able to discuss change with you. So there are some foundational processes that we look at, and the first one, of course, is engaging the person in terms of, may we talk about something here that I brought up that's of concern. That's a question we might ask. Focusing on a specific behavior that may be going on. Evoking is a big part of what we do with motivational interviewing. And then the last part is planning, and we want to get to a plan always about what are we doing in terms of developing commitment around change. And of course that's going to rely on the person that we're talking to, but with the right attitude of engaging, focusing, and evoking, oftentimes we are able to get to a plan that is it's built by or constructed by the client themselves. Well, I wanted to let you know when does engagement start? The first time we meet somebody, where we have questions in our head about are we accepted, we may not even be aware that those kinds of things are going on in our head, but definitely, especially when we're working with adolescents, they're always feeling judged or always feeling as though can I trust this person or not? And so there's a lot of things going on in that person's head even before we open our mouths. So it begins almost immediately. And when we're looking at the 4 processes, here's another way to look at that when you're thinking about motivational interviewing. Yes, we are trying to engage that person. So we're offering them an invitation to walk with them. I'd like to be able to go along with you. Shall we talk about this? Again, focusing the conversation, where shall we go? What would you like to talk about? Evoking, why do you want to have this on? Why is this important to you? And then the planning is, how do you think we should get there? Again, using these 4 processes really helps us operationalize the work that we're doing in motivational interviewing. And I'm quite grateful to the authors of the book, William R. Miller and Stephen Rolnick, for actually in the 3rd edition of the book, they've kind of reorganized that. It's a very helpful book for those of us who are practicing motivational interviewing to operationalize it. One of the here's some things to ask. What changes are you considering? They may say none, but again, and when is it that you make this change? Now, here's what we use with this thing we call the readiness ruler. So you might ask that person, on a scale of 1 to 10, how important is it for you to make this particular behavior change? I don't know, it might be that how important is it for you to be able to get to school every day on time is another way that you could utilize this. Then we ask the question about their confidence. What's your confidence level?
maybe I can't get to school on time because I live 4 miles away and the only way I can get there is to walk, and it takes me a long time to do that. But we want to ask about their level of competence. How confident would you be that you could get up 10 minutes earlier and get to school on time? And then again, the readiness is how ready are you to make this change? So we use this tool. It's a scaling tool. It's a great way for us to kind of think about where is the person's readiness. Now we have some other elements that we look at in terms of readiness. That may be for another conversation other than today. So we look about this kind of things in terms of a person's keys to readiness. Number one, as readiness has to do with how important is it for me to do something different, to make this change, and what's my level of confidence that I am going to be able to do that. And believe me, sometimes the confidence level really can erode a person's readiness because they want to do some changing, but they're not sure they can, or they've tried before and they've failed. So our job is a lot to offer hope for these individuals. When we talk about what's unique to motivational interviewing, there's a specific way that we go about in the conversations. Very intentional and very differential evoking and reinforcement of what we call this change talk. This very strategic and directive use of being client-centered, reflecting and summarizing. And then our sequencing of what we call preparatory change talk. What's the person's desire or importance for change? What's their ability or their confidence about change? What are the reasons they have for change, and what is the need? And then of course we're looking for commitment language. That's that change talk that we're looking for. So at the very, very heart of motivational interviewing, what we're really trying to do is listen, and listen very carefully to the client's struggle with the behavior and picking up from them what their concerns are, because that's really where we're going to be able to get and make a lot of headway, is talking with the individual about that ambivalence. Now, again, listening to their struggle can be interesting and very, again, just listening to them about that is very helpful. Something else that kind of comes up to us, and that is this thing we call the writing reflex. Human beings just seem to have this built-in desire to set things straight. We really feel like it's important for us to do that, and we feel like it's important for us, especially with adolescents. And we call this the writing reflex. We call this that helper that comes out in us, that sometimes it's called helping a little bit too much. So again, it's common for us to want to make things right when we see a problem, but what ends up happening is that we may put persuasion or more information or prodding them in some way, and what that ends up doing actually is pushing them away. So we believe very distinctly that change has to come from the client's intrinsic motivation. That doesn't mean that we can't impact change. Now this is long-term change, that we can't impact change by some external interventions. So some of the things that you might see happen with us is that, again, we don't want to say that this is, there's a few things here that, again, you may look at, but there's some things to check off and think about what is it that we're doing that might be getting some pushback from the persons that we're talking to. Even number two, giving advice or making suggestions sometimes can come off as pushing a person. This judging, the number five, agreeing, approving, and praising. Well, what we're trying to do is kind of get information from the client or get them to talk about it rather than agreeing with them, because when we agree, they just think they don't have to talk anymore. So all of these things kind of put a damper on this conversation, and I love this. Listening is an important part of this, of course, but not listening goes both ways. Stop overeating, stop drinking, stop staying out late, stop fighting, stop worrying, stop eating sweets, stop gambling. What did the doctor say? I don't know, I stopped listening. So when we come to motivational interviewing, what we're trying to do is have these conversations where people really are listening. Otherwise, we are getting what we call discord, and the person begins to distance themselves from us. And even though we may not know what's going on with that, it's very difficult for them to get back in touch from us. That cognitive dissonance, disagreement, or conflict, all those things kind of happen if discord is in the way. And so we look at a couple of things called sustained talk and resistance. So a person who's having sustained talk might say things like, I really don't want to stop smoking, or I have to take my pills. Resistance, of course, is about the relationship. You can't make me quit. You don't understand how hard it is for me. Doesn't matter where these come from, but both of them really impact and are barriers to people change. And think about the Star Wars movie. What are we doing? The resistance is people are going with the resistance because they're fighting the enemy. And that's what it feels like when somebody's pushing at us. We're fighting the enemy. We want to get them. We want to get them away. So both of these kinds of things predict not changing. All right, we have poll question number 3 now, Tiara.
Yes, we would like to ask, what is your writing reflex? Please take a few seconds to answer the question. Okay, we have 3% convince one they have a problem, 28% argue for benefits of change, 23% tell someone how to change, 18% sternly warn them of consequences, and 28% other.
Okay, thank you very much. Well, again, thank you for sharing your ideas on that. It's just important for us to know what those writing reflexes are, because then when we have awareness of those things, we can back off a little bit and try to understand the person from a different perspective. So. Alrighty, so now we use these things called these core conversational strategies, 4 early strategies called the OARS. One is open-ended questions. We try to ask open-ended questions because it gets more information, and when we're trying to evoke from the client, from the person, this is helpful. Affirming, and affirming has to go with, again, affirming the person for change, if change has happened in the past, but affirming them for just even being there. Reflective listening is what Miller and Rolnick would call the backbone of motivational interviewing. Very good skill to have. And then lastly, summarizing. And I always say summarizing is nothing more than just a big reflection. So. All right, and so what we do is we use these 4 strategies, or these 4 areas, to elicit what we call positive change talk. What do I think about change in the future? And so what we call these are tools for guiding people toward change. And there has to be this balance, this very fine balance of what's going on. I mean, we don't want to ask so many questions that that's all we're doing. So we want to think about that in terms of not just questions, but questions, affirmations, reflections, and summaries. And there's a fine balance with that, so in terms of a conversation. It's kind of like what we're trying to be as Sherlock Holmes. We're trying to be curious. We're trying to find out what may be going on, but yet we're doing that with a balance kind of thing that's happening. So here is some examples of change talk and sustained talk. You can take a look at the change talk examples, and of course, what people are doing already. Each of those is just saying, there are different levels of where a person might be at in terms of readiness. Someone is saying, I really need to stop smoking because I'm worried about the example I'm setting for my kids, or I've already started an exercise program. Even the person saying my alcohol use is getting the best of me is a change talk statement. I know I should take my medication as prescribed. On the other hand, you take a look at these sustained talk statements. And again, I'm not hurting anybody. I just, I've always been this way. It's the only way I can get relief from my stress. I just don't want to do that because there's so many side effects. So we take a look at this change talk versus sustained talk, and this may be coming from the person at the same time. Again, they may be telling you, I want to do something about this, but. And so in motivational interviewing, what we really want to do is pay more attention to the change talk than we do the sustained talk. Not try to figure out why the sustained talk is there, but really go back and anchor down this thing that we call the change talk. And we do that again with our OARS, open-ended questions. Affirmation, basically an affirmation is really helping the client move toward a goal, helping them feel comfortable and confident in themselves. And then our reflections, there are different ways we can do reflections. You can reflect where a person is speaking, we can their facial expressions, or even their behavior, like maybe they're very animated and you're seeing that. And what reflections really are is not necessarily repeating back what someone has said, but it's making a guess or a hunch about the deeper meaning behind what a person is saying. So when we're doing reflections, it's a skill that takes a little bit of practice. And then, of course, summarizing is what I call a special form of reflection. You choose what to include and what to emphasize. And again, what you're trying to include is their concerns about change. Are they recognizing there's a concern or a problem? Are they optimistic about change? Are they ambivalent about change? So you're trying to include those things in your statements. Really, what summarizing is also helpful for us to do is let the person know that we are listening to them. And we want the person to kind of give us some feedback. So I usually just say, well, what else? What did I leave out in that? So when we're using motivational interviewing, you know, we can look at it through lots of different lenses, but what do we really want to see? We want to see that the person's engaged with you, that you've set some kind of an agenda along the way. That would be that whole idea of the 4 processes, that you're listening to that struggle or the heart of change, and that is ambivalence, that we're evoking change talk by asking questions, providing affirmations and reflections. We want to recap all the change talk by doing our summaries. And oftentimes we use evoking as a menu of options. What are all the options in front of us that can happen? We negotiate this change plan, and then of course we want to ask, what will you do about the change plan? When will you start it? And so that is what we call the commitment to the change plan. So in change planning, what we're trying to do here is clarifying our goals and looking at all the kinds of things that might need to be put in place to help the person keep on the right path. What are some of the steps that they should take? What are the resources that are available to them? What kinds of things? How will we know if you are successful? What kinds of things might get in your way, that have gotten in your way in the past, and what are the supports that you need from other people? Now, what we say in MI is it's very helpful to think about not going to giving them time to respond to you. Try not to miss the point. Again, really listen carefully. Try not to get too much done at one time, because a lot of times we're trying to get it all done and, you know, we lose everything. Coming across as blaming and then providing as opposed to eliciting solutions. And that's a very important point that we want to continue to elicit from our client. What might help? Well, be clear about any constraints you might have. There may be some that you have, and you want to be clear about those to the student. Try to understand and honor cultural perspectives. Demonstrate this non-judgmental attitude, and do any kind of agreeing on any small change that might be helpful. So on the next slide here, I've got a bunch of resources here. And then these resources, these are specific to schools. In fact, I just picked up the first one, the Motivational Interviewing in Schools. I already have the second one that's called Motivational Interviewing in Schools, Conversations to Improve Behavior and Learning. And the Motivational Interviewing for Effective Classroom Management is an excellent book as well. It has a lot of great stuff in it for you. So now I'm at my time, and basically we're talking about all these things related for time for change, and I'm wondering if there are any questions. Tiara?
Yes, so while we give others the chance to enter their questions, please, in the question box on your control panel. We just want to have a few announcements while we just give you 1 minute to enter those questions. All right. The School-Based Health Alliance works to improve the health status of children and youth by advancing and advocating for school-based health care. Our members extend and support our work. Trainings like this webinar would not be possible without the support of our members. In addition, our members receive exclusive access to valuable programs, tools, timely publications, and networking opportunities. We ask that you visit the website on the screen if you need more information. Also now, our call for abstracts is now open for our 2017 National School-Based Healthcare Convention in Long Beach, California. The deadline is quickly approaching, November 6th. So please visit School-Based Health Alliance for more information. All right, so now I'm going to see what questions we have available. So our first question, Dr. Speck, is can you define the age range for the adolescent craft screener?
Yes, 12 to 17 has been norm for that age range. There may be other kinds of things, but by the time a kid gets to be 17 years old, you might want to use the audit, but it's a very appropriate for 12 to 17 years old.
Okay, perfect. Thank you. We do have quite a few questions about the slides being available. This is being recorded. Within 3 to 5 business days, we will upload the recording in PDF version of the slides, including the resources that Dr. Speck has provided us on the presentations. So something else we have, Dr. Speck, are there sample texts for providers to use when having the conversations with the patients?
Like a little cheat sheet?
Yes.
Absolutely, there are definitely. I've created some. There are a number of them, and I would tell you that in the books that we featured at the very last part of this, you'll get some guidance in that as well. There are some wonderful online or YouTube videos working with schools, so you might want to plug in into YouTube. Students, there's a wonderful series of school counselors working with students, and they have a positive way of doing it using motivational interviewing and a not so positive way of doing it not using motivational interviewing. So there are several of those, yes, and I would recommend those.
Thank you very much. So our next question is, with the clinician skilled in motivational interviewing, how much time does it take to carry out from beginning to end of the interview?
You know, that's very individual, but I would say that a brief intervention, we talk about that, and we talk about it being a one-time kind of thing. So it could go longer, but I wouldn't say any more than 15 to 20 minutes. You're not really looking to do anything more than to provide feedback. Asking permission. Can we talk about this? It's kind of like that shall we walk together, and then finding out, what's the next step is, why is this important for you to look at, how should we get there, and what should we do about it. So I think those you're evoking and again, slowing yourself down a little bit, but once you get the protocol down, I think it's pretty easy to do that within a 20-minute period of time, even less time. It depends on what the feedback is that you have or what kinds of things you're evoking.
Okay, our last question we have for now, in regards to staff, is it usually only the provider that does the motivational interviewing, or are there practices that utilize the med assistant or RN to do these risk assessments?
Oh, absolutely. Anybody can do this. We say that if you have a passion or you want to work with someone who, with people, yeah, anyone can do this. It can be, again, training is an essential piece of that. But definitely, I use motivational interviewing in terms of I work with case managers, people who don't have licenses, people who do have licenses. We train nurses, we train physicians, we train psychologists. Behavioral health counselors, mental health counselors, substance abuse counselors, therapists, social work therapists. Yeah, so the large range of people can put this into place, and it's appropriate to do so. And there are some good SBIRT YouTube videos also, and I would recommend those.
Okay, perfect. We do have another one come in. How often should students from grades 5 to 12 be screened?
Well, I would say that probably an annual screening is not out of the question. And so if you've got somebody in the student counseling office, or you've got somebody who's in the nurse's office, and or look at or even the principal's office, looking at behavior, those kinds of things, you have more information because of those kinds of interactions. But in general, I think an annual screen, just like you'd get screened annually for breast exam for cancer. It's not unusual to have that on an annual basis.
Thank you very much. It seems that's all the questions we have for right now, but is there anything else you would like to add, Dr. Speck? before we close?
No, and I just want to thank you again, Tiara, for all the help that you've given, and to our participants. Good luck, and again, the resources are excellent, and hopefully they'll be of help to you.
Thank you. And before we close, we would like to ask our attendees just a few questions to help us. So did this presentation meet your needs? If you can please just take a few seconds to answer the question. Thank you, everyone. Our next question is, how well did the presentation meet the stated objectives? All right, and our next question is, how likely are you to apply the information from this presentation in your organization? Okay, and our final question is, would you recommend this webinar to others? Great. Thank you so much, everyone, for your attendance, and we really appreciate Dr. Speck for this amazing presentation. And if you have any additional questions or comments, please visit School-Based Health Alliance in our technical assistance log, and we'll be happy to direct your question to the appropriate person. Or you can just email Dr. Speck directly at kspeck2@unl.edu. We thank you, everyone, for participating with us today, and have a wonderful day. Thank you again, Dr. Speck.
Thank you.